Good evening and welcome to Law Line. Law Line is a live call-in talk show brought to you by the attorneys of Levin, Papantonio. My name is Ben Gordon. I'm here with Daniel Nye. And once again, we're going to be talking to you about hip implants, and in particular, a recall that we mentioned last time we were on the show of a product called the Stryker Rejuvenate Hip Stem. And let me just remind everyone, show you a quick picture because a picture's worth 1,000 words. This is a picture, let me turn it over this way, of a modular Stryker stem. I'm going to compare it to the stem we showed you last time, which is a one-piece stem, which is therefore not modular. So this hip implant stem goes down into your femur. The femur is drilled out, it goes down into your femur, and then a ball connects to the top. In the last case we talked to you about, predominantly the problem we were seeing was with the ball and the shell that go into the acetabulum or the hip joint, the hip socket, whereas in this situation, the Rejuvenate hip stem, it's this one, but it's in two pieces. This smaller piece over here to the right fits down into the longer piece, and the problem that has surfaced is corrosion that is taking place because of what they call fretting, an engineering term, between these two small metal pieces. So even though the total hip design of the Stryker device is not considered a metal-on-metal implant, you do still have a metal-on-metal connection here that is leading to the problem we're seeing in the patients. And Daniel, tell the folks a little bit about why this device was recalled and remind them of the timing of that.
Sure. The device was recalled July 4th, 2012, so not too long ago, and the press release was July 6th, 2012, that the Stryker Rejuvenate, and there are a few of you who may have what's known as the ABG2 that was recalled. So not a whole lot of those, but there were some of those that were recalled as well. The problem with the product is, as you can see in the picture, and what I'll show using this product here, is that this modularity, as it was being put inside of the product, there is too much force being put on this part inside of the product. And so as a result, as this thing is moving around, and I'll show you the rest of the hip here as well. So this is the way it attaches. You got the cup that goes inside of your acetabulum, the liner, or some of them don't have a liner, but here with the Stryker Rejuvenate, most of them had a liner. So usually a polyethylene liner, or sometimes it has a ceramic ball instead of the metal ball. And then the stem would fit inside of it, and then this was a modular component that would fit inside of the stem. Now, typically you could get some fretting or corrosion right at this component, but what we're seeing with this modularity is that there is quite a bit of fretting and corrosion taking place at that modular component, because as this thing moves, we get a lot of frictional torque that takes place. A lot of pressure is being put right on that modular component, and instead of having one tight cast of material, you're getting modularity there, which is causing a lot of that fretting and corrosion that we talked about. Now, there may be a couple other theories too as to why this may be causing problems, and one of those may be because of what's known as this TMZF alloy that was put on the outside of this product. That might have been one of the issues for it as well.
Why don't we come back to that? We've got two callers holding. Thank you, Daniel. We're going to go to the first line. Good evening. You're on Law Line. Do you have a question for us?
Yes, I do. My mom is having a revision surgery of a recalled Stryker hip implant in a few weeks. A company called Broadspire has offered to pay for her expenses, but she has to sign some paperwork first. What should she do?
Daniel, you want to take that one?
Sure. Well, there's a couple issues here first, and I think the first thing that she needs to do is probably speak with an attorney, because there's going to be a lot of pitfalls that may take place here. One of those pieces of paperwork, see, Broadspire is set up by Stryker to pay for out-of-pocket medical expenses, so those expenses in addition to whatever the health insurance company doesn't pay. Broadspire is going to step in and pay for those expenses. And it's not that we don't like Broadspire, but there are some pitfalls with her just using Broadspire on her own to pay for these medical expenses. First, she's going to have to sign some paperwork, as you mentioned, and they're going to be asking a part of that paperwork a release for medical records, which can be a problem, but not as big of a problem as the second part, and that is they're going to want to have access to the prosthesis itself. And in these kind of cases, we don't want to give them access to the prosthesis. We want our experts to be the ones who can examine these products first. So that's the first thing. The second part in line with that is before she has a revision, we need to send a letter. An attorney needs to send a letter to the surgeon and the hospital, and also she needs to carry a copy in when she goes into the hospital that asks for the product, the stem itself, to be preserved. And any tissue or any other samples or fluid that may be taken out during that surgery should also be preserved.
And the bottom line is, Daniel, I think, as you touched on, you can't trust your rights to a third-party company hired by the manufacturer. This company is being used also by DePuy, some of you are familiar with, who had the ASR and Pinnacle products. Not saying they're a bad company, but they're there to protect the manufacturer, and they're not there to protect you. Doesn't mean we won't deal with them and trying to perfect your rights, secure your rights, but you need somebody advising you what your legal rights are before you sign anything for a company like Broadspire.
That's right.
All right, let's thank you. Did we answer your question?
Yes, thank you very much.
All right, thank you. We've got 2 more callers. Let's go to the second caller. Good evening. You're on Law Line. You have a question for us?
Yes, I do. I had my first blood test to examine my cobalt chromium levels, and I received the results last week. My cobalt levels were 4.7, and my chromium levels were 2.2 parts per billion. Could you explain what this means?
Sure. I'll take that first, and Daniel can follow up on it. The caller, in case you didn't hear the call, was referring to the blood tests that are ordered by the physicians, which, by the way, now the letters that you're getting from the doctors or from the Broadspire or Stryker, some of them saying directly, recommend that you go in for a clinical examination if you had one of these defective or recalled implants. And among the things that they're recommending during the clinical exam is blood to be drawn and tests to be done to see whether or not there are ions circulating in your bloodstream to the 2 main metals in these devices that we showed you. When these devices break down, when the corrosion occurs, the body's natural forces cause this the tiny particulate debris, this metallic debris, to be ionized and distribute throughout your bloodstream. And what shows up typically are high levels of cobalt and chromium. There's a third element that's really not relevant because it's in such a small amount in the implants. But chromium and cobalt in particular can be toxic, especially cobalt. In this example, the caller has said 4.7 and 2.2 or so of chromium, 4.7 of cobalt. That's concerning. There shouldn't be measurable quantities on a consistent basis of cobalt in particular in your bloodstream. Now, the defendants will say that we get cobalt in food and in vitamins, nutritional supplements, as well as some trace levels of chromium. They'll also say that the chromium present in these devices is of a type that's not toxic, but no one has any real certainty with that yet. In fact, they're all calling for studies to be done to see what the long-term consequences of these levels of chromium and cobalt. But everyone pretty much agrees that if you have over 4 or 5 parts per billion of cobalt showing up and that test is followed up and it's consistent or it's getting larger, then that is a potential problem. What we see beyond that, and Daniel can talk a little bit about this, is what actually happens in the tissue consistently with these people who have the elevated blood levels. You want to talk about metallosis?
Right, absolutely. Well, with those kind of levels, they're kind of in what we call the borderline category. So if it's somewhere between a 1 and a 7, you're in this borderline, and certainly having the 4.7 for cobalt's concerning. And another part of this whole equation is going to be, since this is your first blood test, where there's probably going to need to be another one some down the road, 6 months or a year from there, preferably 6 months, but certainly listen to what your doctor has to say about that. But with that kind of a level, we usually like to see some other kind of imaging study that's going to look at the hip area itself. So either an ultrasound or what's known as a Mars MRI, which is a special diagnostic tool where they can look to see joint fluid buildup, see some of the tissue damage that's occurring. And essentially with this metallosis, these metal ions get out into the body. We're not going to talk as much about what happens when they get in the bloodstream and go everywhere else. There's certainly some difference in the sciences as far as what kind of damage you have from these kind of levels being in the bloodstream. But we're going to talk about specifically right around the hip. What we're seeing, people who have levels comparative to this, when they have a revision surgery, they can have all sorts of necrotic tissue, blackened, dead dying tissue, joint fluid buildup, and the joint fluid's discolored, even pockets of fluid throughout the tissue itself, so that when they're opened up, they may even spray. Certainly a lot of issues that are concerning. And the longer that it goes on, the higher your chances are of having more and more complications. And without following up on it appropriately, it could make it difficult for any future revision to be a success. So it's important to make sure you continue to follow up with those diagnostic studies and follow up with your doctor.
Very good points, Daniel. And you know, it's critical that you follow up on this letter and follow up if you're having any symptoms, particularly groin pain. Groin pain seems to be one of the characteristic hallmarks of a large amount of metallic debris and this kind of damage to the tissue that Daniel's talking about. And there's a lot of studies coming out, a lot of doctors suggesting that if you're having that kind of groin pain, you shouldn't be, absent some kind of acute trauma, you shouldn't have, after several weeks and you've recuperated from surgery, you shouldn't be having severe groin pain, back pain, thigh pain, buttocks pain. And if you are, then it's better to go in sooner rather than later so the doctor can evaluate you clinically and the doctor can determine, are the cobalt levels elevated? Is there radiographic, imaging studies, evidence of loosening of the prosthesis? And am I going to save this patient, needless heartache and long-term severe trouble by going ahead and revising the hip implant sooner rather than later? Obviously, that's a medical decision. We can't tell you, when and if you should get your hip implant out. But the doctors, have come a long way over the last couple of years with all these metal-on-metal hip implants that have been evaluated by the FDA. And there's a growing consensus that if you let this dying tissue Daniel was talking about continue to be exposed to all these levels of metallic debris, that you may be doing yourself a lot more damage in the long run. And many doctors think if you have that evidence, if you're having pain, if you're having any radiographic evidence of loosening, if you're having high cobalt levels, especially if it gets up over 10. We have clients who have cobalt over 100 until they get the implant removed. When they get it removed, it goes back down to normal levels. And the thinking a lot of these doctors is, why let it climb from 10 to 100? If it's 10 already and you have any abnormal pain, go ahead and take it out before it gets worse. Did that answer your question, caller?
It does.
All right, thank you for your call. We appreciate it. All right, Daniel, got another one, another caller. Let's go ahead and take him without further delay. Good evening, you're on Law Line. Can we answer a question for you?
Yes. I understand that these metal-on-metal hip implants have problems, but I thought that the Stryker really was not a metal-on-metal hip implant, but that it was a plastic liner, a polyethylene. So my question is, why was the Stryker hip recalled, or what is the problem?
You sound pretty well informed. You don't work for Stryker, do you?
No, I do not.
Okay, well, just checking. It's okay if you do. Let me just show you this implant that Daniel demonstrated earlier. This is a total hip implant consisting of 4 parts. A non-modular one-piece stem that goes down the femur, a ball that goes on it made of cobalt, chromium, and a little bit of molybdenum inside of a plastic liner, also called polyethylene, that you referred to, inside of an acetabular shell that's also made of cobalt and chromium. This liner, in this particular case, this is not what's been recalled, but it's for demonstrative purposes, is highly cross-linked polyethylene. And it is very hard. You can kind of hear how hard that is. This thing, it really wears very slowly, and while all devices wear out in time, the polyethylene wears very slowly, and most people with these devices get 15, 20 years, sometimes more. Okay. And that's what you expect out of a hip implant. It's going to wear out in time. It's an artificial device. However, what they figured out with these devices that have this stem, even if they are connected to a plastic liner, a polyethylene liner for the acetabular portion that goes onto the ball and into the socket, this device, because of its modular nature and has 2 pieces, metal that go into metal here, there is this corrosion and fretting issue that's different from the other metal-on-metal implants that don't have the plastic liner and have more of a metal wear issue at this junction instead of at the stem junction. Now again, it's a variable phenomenon, and the language is kind of being worked out, because you might think, well, why not just call this a metal-on-metal hip implant, because there's metal on metal. So in some sense it is. The language isn't precise, but most physicians do not refer to the Stryker as a metal, since the stem is a 2-piece modular stem that has this junction with 2 metal pieces. I hope that answered the question. Maybe I didn't answer the part about the recall. The reason this device was recalled, Daniel talked a little bit at the top of the hour, you may have missed that, this was simply because of the corrosion and fretting issues. In fact, let me read to the caller what Stryker said in their press release on July 6th. Now they recalled this device, by the way, in April or May in Canada, I think it was. Daniel may correct me, and not for a few months later here in the States for whatever reason. They were doing something and delayed that. They did send doctors letters in May and June telling them essentially this is a product recall communication, and so we're telling you that we don't want you to put these things in anymore. We want you to follow up with your patients, do this blood work. They didn't announce it to the general public, though, for whatever reason, until July 6th. And they did this. Stryker initiates a voluntary product recall of modular neck stems, action specific to rejuvenate and ABG2 modular neck stems. That's what they're called, the two different devices that are very similar. And here's what they said. They said, while modular neck stems provide surgeons with an option to correct certain aspects of the patient's anatomy and hip biomechanics, given the potential risks associated with fretting and corrosion at the modular neck junction, the two metal pieces I showed you, Stryker Orthopedics decided to take this voluntary action, said Stuart Simpson, Vice President and General Manager, Hip Reconstruction. So they're trying to put, obviously, the best spin they can on it to say that it was voluntary. The FDA didn't make them do it, that kind of thing. Obviously, the FDA is scrutinizing these devices more and more, and they were going to make them do it, so they were allowed them to pull it off the market themselves voluntarily. So I hope I answered your question.
Yeah.
Thank you, caller.
I think there's one thing I'd add there too that distinguishes these from the metal-on-metal hip implants, and that is the revision is a lot more complicated than what we saw from the metal-on-metal hip implant, and specifically the DePuy ASR recall was one of those metal-on-metal. This implant here, I mean, obviously this is not the Stryker Rejuvenate, but this is stuck into the femur bone, and this is the component, this whole component has to come out, whereas with the DePuy ASR, you just have the cup, the ball that has to come out. This is a much more painful revision sometimes, because oftentimes what takes place is this is very well driven inside of the femur bone. It's almost like cemented inside of the femur bone. It's that compacted in there oftentimes. And so as a result, we're having to have this part taken out, which can be a lot more intrusive than what we saw from the metal-on-metal hip implant.
That's a good point, Daniel. And I was going to try to show a picture that I had seen at one of these conferences that we attend, but to demonstrate that point, surgeons describe this stem as being like rebar in concrete, being so well fixed. And so one of the big questions is, for surgeons, do I take out a well-fixed or almost cemented, as Daniel said, stem out of someone's hip? Because what that requires is, as he said, is cutting the femur bone, largest bone in the body, and opening that up and just prying that thing, ripping that thing out of your leg bone, and that's a big deal. And then when they put a new one back in, they have to put the bone back in there, graft it together, and suture it, and then tie it around with wire that's going to stay in your leg, hopefully the rest of your life. The reason that some surgeons are doing that in many cases now is they believe that over time, if you've got this metal corrosion issue going on, that you're going to get more and more tissue damage, and you're going to have an even bigger operation if you don't do it. And I've got here a picture of some of the tissue, and I don't want to gross anyone out, but I don't know if we can zoom in on this, but this shows you at least a picture of the, down on the bottom right here, I don't know how it shows up on screen, zoom in on that, that shows actually where the bone is into the femur and what it looks like after it's been ripped out. Now, I'm not going to show you the pictures that show the actual condition of the bone after the fact, but you can see how that gets bone ingrowth on it, and it's a big deal to rip that thing out of a person's leg.
Right.
So I think we're finished with callers. Why don't we talk a little bit about the litigation, because I know that folks may be a little bit squeamish about filing lawsuits, and for the doctors out there, our goal is not to sue doctors. We don't think doctors are to blame here, and we haven't sued one doctor yet in this litigation all the years we've been doing the hip implant cases. In fact, we believe that doctors were not aware of the clinical safety issues with these devices because the bioengineers, the biosafety engineers for the companies sold the doctors a bill of goods. They said this is a better product. You can use it in younger patients, you can use it in more active patients, and what they were doing was increasing by several times the ability to reach more and more and more patients. They were telling doctors, these things don't have to be reserved for the 70 and 80 and 90-year-olds, which was historically the case. You can put them in 60-year-olds and 50-year-olds and 40 and 30 and 20-year-olds. We have a 21-year-old client, a 24-year-old client, and a 29-year-old client. So unfortunately, those people are much more active and typically and create more of a burden on the device. And it may well be that marketing these things to a broader and broader community of people was not sound business. It may be that the manufacturers had a responsibility to have told physicians that we're not sure what the long-term consequences may be in people who are more active and younger, more athletic. And in fact, this claim that they made in their marketing materials that these things would wear less, that is, they would create less metal debris and would be more stable in a younger, healthier, more active population were not true. They simply didn't have evidence to back that up. And in fact, we know from at least one of the cases we work on that they had evidence to the contrary, and that people who are this active and all were having a lot of metallic debris at various points within these metal implants. And so it begs the question of whether or not surgeons should have been told early on that moving these devices into a younger and younger population of patients might not have been borne out by the testing and the science that either was done or should have been done.
Right. And the other thing is their literature will often talk about, having less than a 1% revision rate after 5 years. We're going to see some of what Stryker Rejuvenate specifically promised with this product. But normally what we tend to find out is after the recall, we see 15, 20% or even more have this metallosis complication and need to have a revision. So we'll see as time plays out, but we're certain we're probably going to see more and more folks having revisions as a result of this bad product.
And speaking of that, we represent a number of Stryker folks right now. We're getting more calls every day. A lot of you will be getting letters soon. What are we doing? We have, so far, we've talked to you a little in the past about multi-district litigation. Daniel and I are on some committees for the Depew case, two of the Depew cases that oversee nationally the coordinated multi-district litigation for the Depew, ASR, and Pinnacle cases. There are other cases for Wright Medical products, Smith & Nephew products, and Biomet products that Daniel and I work on, a fewer number of cases, but we're also willing to talk to you about those. If you've had an implant put in the last 3 or 4 years especially, and you're not sure what it is, we can help you find that out. If you've gotten the letter from the doctor, you've gotten a letter from Stryker, then probably you know that you have a Stryker Rejuvenate. You may know if you've gotten a little card from the doctor whether or not you've gotten perhaps a recalled product from Depew or from Smith & Nephew or one of these other companies. But if you don't know, we'll be happy to talk to you about that and help you figure that out and see if we can help you. But what we're doing is we're filing lawsuits in various jurisdictions with Stryker that we think ultimately will be put into one of these MDLs that are referred to, this multi-district litigation. Hasn't happened yet. We believe there are more than 20,000 of those recalled stems put in, and that many thousands will have to come out. So we think the chances are good that the judicial panel on multi-district litigation will see fit to consolidate these cases before some federal judge. And in that event, your case would not be part of a class action per se, but we would file it in a district court in Pensacola or Mississippi or Alabama, wherever you live, and then ultimately would be transferred to this MDL, and Daniel and I, in all probability, would be appointed to help manage that litigation for the plaintiff's side. It is possible that the cases would go to New Jersey because there is a judge up there who is handling a bunch of these cases because Stryker is located there, and you can file the case either where you live or where the cause of action accrued or the defendant's principal place of business is. So we're not 100% sure on the Stryker claims where your case would be filed yet, but you can rest assured it'd be handled as an individual case, even if it's consolidated with others, and we would work it up individually for trial or settlement. Daniel, anything to add to that?
Yeah, the only thing I'll add is if you've had any surgeon tell you that you have a recalled product, there are a lot of pitfalls that you can fall into with this kind of a case. I think as soon as you find out that you even have a recalled product, let alone have any problems with it, but as soon as you find out that you have a recalled product, you should call an attorney because there's several pitfalls that you can fall into this, and you should ask about your rights given the recall.
We've got about 2 minutes left, and let me just add to that. Probably most of you know this, but obviously there's no obligation if you call our call our firm. There's no fee and no cost to you in calling our firm or sitting down and talking with me or Daniel or one of the other attorneys working on these orthopedic device cases. We work strictly on a contingency fee basis, and if we're able to recover for you, you make a decision on settlement or going to trial, and we recover a percentage of the ultimate verdict or settlement with your permission if the case is resolved or if we go to trial. So a lot of people I know will still, not knowing that that's the system, obviously be concerned that they're not only having to shell out co-pays and other out-of-pocket expenses for medical care and doctor's visits. They're also concerned that they're going to have to pay us for our time. Just want to make sure you understand that's not the case. And you can email us or call us, and we'll be happy to talk to you. I don't know if our email's on the screen, but I'll give you mine. It's bgordon@levinlaw.com. bgordon@levinlaw.com. Daniel's is dnigh, D-N-I-G-H, @levinlaw.com. So I think that just about wraps it up. Daniel, anything comments to give them that we've forgotten?
That's all.
I think the bottom line is you don't know what your rights are going to be until you talk to a lawyer, until you follow up with your doctor. And our biggest thing we see the most that people are concerned about is if you've only had this device in your body for a year. In fact, many of the local people we've talked to have only had the implant in for 11 months, 10, 11 months. What we're seeing in the studies that are coming out so far is that most people, it takes a year and a half to 3 years to see a frank failure of the device. That is, to see enough metallosis, enough metal reaction and tissue damage to where it becomes symptomatic, to where either you can report pain to your doctor or other signs of loosening, like clicking and popping and those kinds of things, or your physician sees radiographic or other clinical evidence of loosening. So, hopefully you won't have a problem. Not everyone will, but just because you don't have a problem a year or two after surgery, you still should call and check out your legal rights because the statute of limitations is running. So I think that's it. We're going to wrap it up, and we really appreciate you tuning in. Feel free to call us at the office, 435-7000. I'm Ben. This is Daniel. We'll be happy to talk to you or answer your emails. So thanks for tuning in.